Hey, welcome back to our table talk. Today we're going to talk about why a person would want to have still scoliosis treatment even if they didn't have pain. A lot of times when we're looking at it, pain is a lousy indicator of health. Most of the time people will have things that are going on under the surface and pain shows up last, which means that you've had it for a long time and it's chronic. And then when we do treat, it is going to take a lot longer to get better. So pain is a horrible indicator of health. If it was such a good indicator of health, people would never have a heart attack. But we see people with heart attacks all the time, and they've had no pain prior to the heart attack. So pain is a lousy indicator of health. The second thing is gravity is not taking any breaks. It's continually going to be pushing down on the spine. So if it is curved, it's going to continue to press down on that spine as it develops, as you age. And by the time that you fast forward another 30, 40 years, you might be a surgical candidate, or you might have other issues where the organs aren't working properly because the nerves are actually getting squished on the way out of the spine, and that could be a thing. That does happen when you have really excessive scoliosis. This is why they'll end up doing like braces and surgeries and those kinds of things. If there's like 30, 40 degrees of scoliotic curvature, they will do that. So that's one of the reasons. So gravity is not taking a break. It's continually pushing down on the spine, and it only gets worse over time. Now, there is a Goldilocks window to treat scoliosis too, by the way, and that time tends to be about 10 to 11 to about 35 or 36. That's my Goldilocks window. If I can find a patient in that time frame, we usually can straighten it out, especially if it's not over that 20-degree mark. So, that is one thing to consider. Not all chiropractors do scoliosis treatment. We're probably the only one in about 100 miles that does it that I'm aware of here. So those are the two things to consider is that time frame. So if you have scoliosis and you have kids that have scoliosis, obviously they might not have pain, or they might have aches and pains that they've been complaining about. So you will want to get them checked as well. And that brings me to it. It's highly genetic. I've had families that the parents have had scoliosis, and then we look at the kids, and about 3 out of 4 kids have scoliosis as well, or I mean, at least half of them do. And so it is highly genetic. If I know that that you have it, or if grandma had it, we definitely want to get you checked as well to make sure that you don't have it. Because if you do, and you're in that Goldilocks time, that is the time to fix it. So these are things to consider with scoliosis. This is why we treat it, even if there's no pain, because I've had people ask me why you would treat it, but that is exactly why. Keep watching us. We'll keep giving you more health tips. Take care.